Welcome to Comfort Home Health Emergency Management Training. In this video, we'll equip you with the knowledge and skills necessary to respond effectively in emergencies and disasters. Let's start with our objectives. By the end of this training, you will be able to distinguish between emergencies and disasters, understand the importance of patient education in disaster preparedness, conduct risk assessment and hazard vulnerability analysis, implement emergency policies and procedures, activate and deactivate emergency plans, identify key staff roles, develop patient care plans, promote patient and staff preparedness, establish effective communication during emergencies, prepare essential car supplies, coordinate office staff, task, and use CareFicient effectively. Respond to emergency notifications. Assess patient risk. Prioritize patient care based on risk levels. And utilize a call tree effectively. Let's begin by understanding the difference between emergencies and disasters. Knowing this difference is crucial for effective emergency management. Emergencies are situations that require immediate attention. They are typically localized events, meaning they affect a specific area or organization. In response to emergencies, we usually initiate a rapid localized response to address the issue promptly. Emergencies are often of shorter duration, meaning they are resolved relatively quickly. On the other hand, disasters are characterized by widespread and severe disruption. They impact a larger area or region and require a coordinated multi level response to manage the scale of the crisis. Unlike emergencies, disasters can have a longer lasting recovery phase, which means they may take more time to fully recover from. So, why is it important to distinguish between the two? Understanding whether we are dealing with an emergency or a disaster help us tailor our response. Emergencies often require immediate localized action, while disasters demand a more extensive and coordinated effort due to their larger scope and longer recovery period. By recognizing this difference, we can allocate resources and respond effectively, ensuring the safety and well being of both our staff and patients during challenging times. Now that we understand the difference between emergencies and disasters, let's delve into the critical role of patient education in disaster preparedness. Educating patients ensure they can actively participate in their own safety and care during emergencies. Patients' education should include all kinds of disasters. Disasters can be broadly categorized into natural and man made. Natural disasters are events that occur due to natural process and can include hurricanes. These are powerful tropical storms with strong winds and heavy rainfall. Earthquakes, sudden shaking or movement of the earth's surface caused by tectonic shifts. Floods, overflow of water onto normally dry land, often caused by heavy rainfall or storms. Wildfires, uncontrolled fires that spread rapidly through vegetation. And tornadoes, violently rotating columns of air extending from thunderstorms to the ground. Man made disasters are events primarily caused by human action, including industrial accidents, chemical spills, or explosions in industrial facilities, terrorist attacks, deliberate acts of violence intended to cause harm and panic, cyber attacks, breaches of computer systems or networks that disrupts operation. Infrastructure failure. Failures in critical infrastructures like bridges or dams. Patient education is vital because disasters, whether natural or man made, can be sudden and chaotic. When patients are informed and prepared, they can know evacuation routes and procedures, understand how to take shelter or protect themselves, ensure a supply of essential medications, know how to reach out for help or check in with healthcare providers, understand how to manage health conditions during crisis. By educating our patients about the specific risk and preparedness measures related to various disasters, we empower them to take active role in their safety and well-being. It's a fundamental step in ensuring that our patients are resilient and are able to cope with the challenges that any disaster may bring. With patient education in mind, let's explore how to assess and manage risk effectively. In this section, we'll explore risk assessment, a fundamental step in emergency management. Risk assessment is the process of identifying, evaluating, and understanding potential hazards or risk that could impact your organization or community during emergencies. It's like making a list of what could go wrong so you can plan how to prevent or respond to those challenges effectively. Once we've assessed risk, we need a way to prioritize them. That's where hazard vulnerability analysis comes in. Why is risk assessment important? It helps us in several critical ways. By identifying risk, we can prioritize our efforts and resources where they matter most. It enables us to take steps to prevent or reduce the impact of potential disasters. It forms the basis for developing emergency plans and procedures tailored to the specific risk we face. It helps allocate resources effectively, ensuring they are available when needed most. Hazard Vulnerability Analysis, or HVA, is a systematic way to score and prioritize risk based on their likelihood and potential impact. It helps us focus our preparedness efforts where they matter most. Now, let's talk about how to score risk. We use a method known as Hazard Vulnerability Analysis, or HVA, to assess the score risk. Here's how it works. Start by identifying potential hazards that could affect your organization or community. These can include natural disasters like hurricanes or man made events like power outages. Measure the probability and vulnerability of each hazard. Assign scores for each category: high, moderate, or low risk. Each level corresponds to a score from 1 to 3. Consider the potential impact of each hazard. Assign scores based on the potential disruption it could cause. Evaluate your agency's level of preparation for each hazard. Assess whether it's poor, fair, or good. And finally, calculate the total score of each hazard by adding the scores from likelihood, vulnerability, and agency preparation. A higher total score indicates a higher priority for risk assessment and planning. Let's consider an example of assessing the risk of a hurricane at Comfort Home Health. For step 1, identifying hazards. That would be the potential arrival of a hurricane. Step 2, A, likelihood. Give the score of 1 for low risk, meaning rare hurricanes in the region, a score of 2 for moderate risk, meaning occasional hurricanes in the region, and a score of 3 for high risk, meaning frequent hurricanes in the region. Step 2B. Let's evaluate the vulnerability. Give the score of 1 for low risk, meaning well prepared with hurricane resistant infrastructure and equipment for safeguards. A score of 2 for moderate risk, some hurricane resistant measures in place, but improvements needed. And a score of 3 for high risk, meaning lack of hurricane resistant infrastructure, critical equipment located in vulnerable areas. Step 3. Evaluate impact. Hurricanes can disrupt operation, damage equipment, and pose health risk to patient. Give a score of 1 for minimal disruption and equipment damage, a score of 2 for moderate risk or moderate disruption and equipment damage, and a score of 3 for high risk, meaning severe disruption, equipment damage, and health risk. Step 4. Measure agency's level of preparation. Assess Comfort Home Health's level of preparation for the hurricane. Give a score of 1 for poor, meaning lack of hurricane response plan and equipment safeguards. A score of 2 for fair, basic hurricane response, planned but room for improvement on safeguards. And a score of 3 for good, meaning comprehensive hurricane response plan, effective safeguards, and regular training. Step 5 is total score. Calculate the total score by adding the scores from likelihood, vulnerability, and agency preparation. In this example, with a high likelihood, high vulnerability, and a good preparation, the total score is 9. Outcome. Based on the total score of 9, a hurricane represents a high priority risk that demand careful assessment and planning. Comfort Home Health should focus its resources on developing and implementing a comprehensive hurricane response plan, improving infrastructure safeguards, and conducting regular training to mitigate the potential impact of a hurricane effectively. This example illustrates how risk assessment helps organizations like us prioritize risk, guiding our preparedness efforts based on the likelihood, vulnerability, and level of preparation for specific threats like hurricanes. By conducting a hazard vulnerability analysis and scoring risks in this manner, we can create a comprehensive assessment that not only identifies risk but also prioritizes them based on their potential impact and our level of preparedness. This ensures that we focus our resources and attention in the most critical risk, ultimately enhancing our emergency management efforts. Remember, risk assessment is an ongoing process. Regular reviews and updates are essential to adapt to a changing circumstances and emerging threats. With a clear understanding of risk assessment and HVA, let's move on to the next crucial aspect of emergency management: policies and procedures. These guidelines help ensure a coordinated and effective response during emergencies. Policies and procedures. Staff receives disaster preparedness training during orientation and at least annually. During natural or man made disasters, management staff review safety conditions regularly. Staff must call the corporate office every 3 hours for updates and listen to radio stations for information. Staff and patients will be contacted using a call tree, email, or text messages. The scheduling coordinator schedules patients' visits based on need. All patients will be called to assess their safety and immediate needs, limiting visits to necessary ones. Arrangements for immediate care, like ventilator or oxygen dependent patients, are made during the start of care. The nurse closest to the patient in need of care during the disaster will provide care. After each drill, an evaluation identifies strengths and weaknesses, using weaknesses as an opportunity for improvement. Now that we understand policies and procedures, let's explore how they are activated and deactivated. Emergency plans serve as a roadmaps for corresponding to different scenarios. In this section, we'll discuss how these plans are activated when needed and deactivated when the situation is under control. Incident Commander Authority. The Director of Nursing, Administrator, or COO, serves as an incident commander and has the authority to activate or deactivate the emergency preparedness plan based on available information indicating the need. Our primary goal is to ensure a seamless transition of patient services and maintain continuity of care for all patients served by the agency. In case the corporate office becomes unusable due to the emergency, the administrator's office will serve as temporary office. Some office employees may work remotely until the office can reopen. Communication and resources. Throughout the emergency, the administrator and the director of nursing will have access to essential communication tools and resources, including battery operated radios and TVs, cell phones, an emergency generator, and government emergency telecommunication services cards. It's crucial to have a clear communication and backup resources in place to ensure effective decision making and continuity of operations during emergencies. With the plans in place, it's essential to know the roles and responsibilities of key staff members during emergencies. During emergencies, various staff members play critical roles. Understanding these roles is crucial for effective response in patient care. Key staff roles: Hurricane Watch Coordinator monitors hurricane alerts and updates, communicates relevant information to the team. Incident Commander receives patient census separated by triads level 1, 2, 3, and 4. Coordinates patient distribution with designated personnel. Office Security Team secures the office before leaving for safety. Post contact information at the office door. Communication Coordinator shares command center contacts information with all clinicians. Initiates the call tree for their respective areas. Call tree initiators. We will have a designated initiators for comfort area, JoJo rehab area, and APOMS area. Patient contact and reporting. Call and confirm emergency plans with assigned patients. Document all interactions immediately in CareFicient. Patient contact and reporting. In case of patient refusal to evacuate, document safety and hurricane preparation education. Encourage evacuation respecting patient's choices. Unreachable patient notification. If unable to reach a patient, document the attempt and message status. Notify the director of nursing immediately. Alternate command centers. Command centers will be announced by the Director of Nursing or Administrator. Please note that the office will reopen as soon as it is safe. During emergencies, various staff members play a critical role. Understanding these roles is crucial for effective response and patient care. These designated responsibilities ensure efficient coordination, patient safety, and proper documentation of actions taken during such events. Now that we know the roles, let's dive into patient care planning. Patient care planning ensures that our patients' needs are met during emergencies. It involves assessing their specific requirements and developing a plan to address them. Patient preparedness is equally important. Let's explore how we can help our patients prepare. For the admitting clinician, they assign priority levels, evacuation zone, and emergency plan during start of care. Completes the disaster level with a comprehensive plan and alternate contact information. Patient preparedness directs patient to a list of items to prepare and have readily available as per Appendix B. Power dependent patients registers patients requiring power for life support equipment with local utility companies and emergency offices. Patient education ensures that every patient and their family receives education to help them manage emergencies effectively. Special consideration ensure patients with the heart disease or respiratory issues who have no one to rely on have a safe place to go. Obtain emergency contacts to maintain communication with patients. ALF clinicians must come to the ALF during emergencies. If not possible, the facility is responsible for insulin administration. ALF clinicians should communicate with ALF management to confirm their willingness to administer insulin in case of a disaster. Provide point of contact information and ensure insulin and needles are readily available and secure. Specific facilities like Vineyard Inn and Me's Life will be coordinated by a designated staff. Wound care patients attempt to see wound care patients the day before a known hurricane. Instruct ALFs to provide basic first aid or reinforce wounds if needed and leave necessary supplies. For level 1 patients, double check their evacuation plan and review supply list, including backup equipment like portable oxygen, deliver point of care on the first disaster warning. Ensure all patients' medical supplies are labeled with their name, vendor name, and contact number. Patient preparedness is about empowering our patients to take an active role in their own safety and well being during emergencies. It's a critical aspect of our care. Patients should prepare for 96 hours with adequate supplies of food, water, and medications. Patients should bring their admission booklet, including updated triage levels, medical supplies, physician information, and emergency contact numbers. Review disaster education information in the admission booklet with patients and caregivers. Instruct patients on how to use flags or signs in their door, preferably kept in a closet closest to the front door. Ensure flu and pneumonia vaccinations are up to date, especially for elderly who may face weakened immune systems during pandemics. Refer to the admission booklet for a comprehensive list of emergency supplies, including adequate lighting and prevent falls during power outages. Emphasize the importance of having a 7-day supply of medications. Encourage patients to keep a pair of sturdy shoes and socks in a Ziploc bag under their bed. Advise patients to secure list of financial accounts, insurance policies, titles, and VA information. Ensure patients are aware of emergency exit locations. On admission, notify the power company regarding the use of oxygen, vents, pumps, or other medical equipment. Use OASIS coding for clinical risk to assess the likelihood of clinical exacerbation. Use OASIS coding for enhanced risk during outside emergencies to assess patient independence with medications, oxygen, and competent caregivers. Now that we've covered patient preparedness, let's shift our focus to clinician and aid preparedness. Staff readiness is just as vital as patient preparedness. Let's discuss how clinicians and aides can prepare themselves to provide the best possible care during emergencies. Clinicians and aides should also be prepared for 96 hours. Secure yourself and your family before anything else. Report to the agency command center in your respective county via phone, text, or email. Ensure the safety and security of your patients. Prepare cell phone chargers, battery chargers, or solar chargers. Familiarize yourself with FEMA communication flag kits or evacuation signs. Consider GMRS two-way radios with a 2 to 10-mile range. Keep a copy of clinical license or company ID with you for identification during emergencies. Maintain at least half full gas tank at all times. Stay up to date on vaccinations like flu, tetanus, shingles, and pneumonia. Now that we've covered communication, let's move on to the practical considerations like car supplies. Having the right supplies in your vehicle can make a significant difference during emergencies. We'll explore what essential items should be in your car to ensure you're well prepared on the go. Pack water, high energy bars, and shelter items like blanket and tarp. Include basic first aid supplies, including biohazard bags. Carry emergency money in low dominations. Having a long life flashlight, backup batteries, solar charger, and hazard light. Keep a first aid kit with N95 mask and alcohol hand sanitizers. Include extra sticky post it notes and a pen for leaving messages. Carry a box of gloves and a pair of work gloves to protect your hands. Consider a portable radio with fresh batteries, a crank, or a solar charging capabilities. Coordination with office staff and utilizing CareFicient is essential for smooth operations. Let's delve into office staff tasks and tools. In the event of an emergency, it's essential that our entire team works together seamlessly to ensure the safety of our patients and the continuity of care. While our field staff are on the front lines, our office staff play a crucial role in supporting them and maintaining critical operations. One of the key tasks of our office staff is to provide support by generating a demographics report. This report includes essential information about our current patients and is provided to our Director of Nursing and Administrator. It helps them make informed decisions during the emergency response. Additionally, our office staff can generate automated reports as needed. This includes copies of current service notes for the past week, patient fact sheets, and copies of the disaster plan. These reports assist our field staff and management in ensuring that all necessary information is readily available. Coordination and communication. Our office staff also play a vital role in coordinating and communicating during emergencies. They assist in maintaining clear lines of communication between field staff, management, and patients. In case the corporate office becomes unusable due to an emergency, the administrator's office serves as a temporary office. Some office employees may work remotely until the office reopens. This ensures that essential functions can continue even if the physical office is affected. In times of crisis, our ability to work as a unified team is what sets us apart. Field staff rely on office support to access critical information, coordinate patient care, and stay connected. Together, we ensure the safety and well being of our patients and uphold the highest standards of care they deserve. By following our emergency response procedure and leveraging the support of our dedicated office staff, we can face any challenge with confidence, knowing that we are well prepared and committed to our mission of providing exceptional care even in an emergency. As we wrap up, let's provide essential information for patients, ensuring they are informed and prepared. In Appendix B, we'll provide patients with essential information they need to know about emergency preparedness. This information is crucial for their safety and well being during emergencies. Appendix B can be found in the patient's admission pocket. If the patient has a caregiver, the caregiver must accompany the patient and remain with them at the special needs shelter. Patients evacuating to the special needs shelter should bring the following: bed sheets, blankets, pillow, folding lawn chair, and air mattress, medications, supplies, and equipment list provided by the Home Health Agency. Cell phone and emergency contact numbers for the patient's physician, pharmacy, and if applicable, oxygen supplier. Do not resuscitate form if applicable. Name and phone number of the patient's home health agency already in the packet admission. Prescription and non prescription medication for at least 72 hours. Oxygen supply for 72 hours if needed. Copy of the patient's plan of care to be delivered to level 1 patients by the case manager on the first notice of possible evacuation, and level 2 patients if evacuating. Identification and current address. Special diet items and non perishable food for 72 hours. Several gallons of drinking water, approximately 1 gallon of water per person per day. Glasses, hearing aids, batteries, prosthetics, and any assistive devices. Personal hygiene items for 72 hours. Extra clothing for 72 hours. Flashlight and batteries, self entertainment and recreational items like books, magazines, and quiet games. Important shelter information. Caregivers accompanying patients will have floor space provided but must bring their own beddings. Service dogs are allowed in the shelter. Check with your local emergency management office regarding other pets. Patients should bring personal snacks, drinks, and any special dietary food for 72 hours as sparse meal may be provided. Caregivers who regularly assist the patient at home are expected to continue providing the same care in the shelter. Being prepared and informed is essential during emergencies. By following these guidelines and having the necessary items on hand, you can ensure your safety and well being in a special needs shelter. Now that we've equipped you with this information, Let's discuss the actions to take once emergency notification is received. Do not leave your home unless you're evacuating or have received your assignment. When you receive a call with your assignment, please refrain from asking questions. This will help maintain the efficiency of call and response times during an emergency. Rest assured, when you receive your assignment, you will receive all the necessary information about the emergency and those affected. It's important to wear your name tag to ensure easy recognition by other cooperating agencies and team members. To ensure uninterrupted communication, please stay off the phone so that your second call can come through without any issues. When an emergency notification is received, it's essential to know how to respond promptly and effectively. We'll cover the steps you should take in this critical phase. If you're away from home when an emergency happens, call the corporate office to let us know that you are available to help. You will receive an assignment at that time. If there are no working telephones, make your way to the triage site closest to your location for assignment. Management will be present at the triage site, and all assignments will be made from there. Once you've assessed the situation, you'll need to prioritize patient care based on the risk levels. Let's explore this in our next section. Assessing patient risk is a crucial aspect of our emergency preparedness. It helps us prioritize care and allocate resources effectively. Let's break down the patient risk levels and understand their significance. Level 1: High risk patients. These are patients who require uninterrupted services. There's no available caregiver or family present, and the patient cannot be left alone for extended periods. Examples include bedbound or chair-bound patients with physical assistance needs, patients unable to self-administer daily medications like injections, wound care patients who cannot perform dressing changes, and those receiving infusion therapy. Let's look at the example situation. Imagine a level 1 patient, John, who is bedbound and requires daily wound care due to a surgical incision. He cannot administer medications himself and doesn't have any family members available. In an emergency, every possible effort must be made to see John. Level 2: Moderate risk patients. These patients needs assistance or reminding but can manage for a short period. They may use assistive devices or are stable in using medical equipment. Examples include patients stable with medication administration, those with reasonably managed chronic diseases, and patients whose visits can be postponed for up to 3 days without harm. Let's look at the example. Sarah is a level 2 patient with a stable chronic condition requiring medication reminders. She uses a nebulizer for breathing treatments. In an emergency, her care can be postponed briefly, but she needs assistance with medications and her nebulizer. Let's move on to level 3: Low risk patients. Low risk patients are stable and have access to informal support. They may have family or caregiver support systems in place. Examples include patients with less complicated wound care, those who are mobile and independent in functioning, and those who can manage and administer their medications. Let's look at the example situation. Emily, a level 3 patient, has a supportive family and manages her diabetes independently. Her care can be safely managed by her family for a longer period if needed. Finally, level 4: Lowest risk patients. These patients can evacuate or manage without agency assistance. They have willing and able caregivers available, or fully independent in most activities of daily living. Visits for these patients can be postponed for 72 hours or more with minimal adverse effects. Let's look at the example situation. Consider Mary, an independent and mobile individual with no significant medical conditions. In an emergency, Mary can manage without agency assistance for an extended period. Her caregiving needs are minimal, allowing visits to be postponed for 72 hours or more with little or no adverse effects on her well being. By accurately assessing patients' risk and understanding these levels, we can prioritize care and resources, ensuring that those who need immediate attention receive it, while those maintaining support for patients who can manage for a short period of time during emergencies. By accurately assessing patient risk and understanding these levels, we can prioritize care and resources, ensuring that those who need immediate attention receive it while also maintaining support for patients who can manage for a short period during emergencies. Finally, let's wrap up with the final emphasis on communication, underlining its critical role in an emergency response. Effective communication is at the heart of our emergency response efforts. It ensures that critical medical information is shared, patients are cared for appropriately, and our community partners are informed. Sharing medical information. Patients evacuating. It's vital to take their admissions booklet with an updated medication list. A plan of care or assignment of duty for aides should be readily accessible. Importantly, all information sharing must meet the requirements of the Health Insurance Portability and Accountability Act, safeguarding patients' privacy and confidentiality. Communication plan. Internal Agency Command Center. Clinicians should report patient status to the Comfort Home Health Agency according to their assigned triage level. This information is essential for prioritizing patient care. A quarterly updated list of patients' triage level is maintained by clinical coordinator with immediate updates upon the first notice of a disaster warning. Be sure to report any patients you cannot contact. External community reporting. Using information communicated from agency staff, complete the disaster log. Document which local entity has been informed of the urgent needs of patients of evacuation, assistance, and disposition. This could include EMS, hospitals, evacuation centers, health departments, and more. Priority should be given to triage level 1 patients. In conclusion, effective communication is the thread that ties our emergency response together. It ensures that our patients receive the care they need, that our community partners are informed, and that we can respond swiftly and effectively to any crisis. We're committed to upholding the highest standards of communication to safeguard the well being of our patients. In our emergency response efforts, we use a disaster communication form to efficiently capture and relay critical information about our patients. This form ensures that we have the necessary details to coordinate care and communicate effectively during disaster or emergency situation. Disaster communication fields. It should include patient's name. This field captures the name of the patient, providing a clear identifier for each individual. For current location, here We record the patient's current whereabouts during the emergency. Phone number. This field is vital for maintaining contact with the patient or their caregiver during the crisis. Any essential notes or specific information about the patient's condition or needs can be recorded in the notes section. Reported to and time. This part documents where and to whom the patient's information has been reported, along with the timestamp of the report. This helps ensure that the right entities are informed promptly. Disposition. The disposition field indicates the planned course of action for the patient, such as evacuation, medical assistance, or further assessment. The disaster form is a crucial tool in our emergency response procedure. It helps us maintain contact, share information, and coordinate care during challenging situations. Ensuring that this form is completed accurately and promptly is vital to our ability to respond effectively to emergencies and safeguard our patients' well being. The administrator, director of nursing, or the designee initiates the call process. Clinicians contact their patients in order of priority. If a patient isn't reached, a message is left and a call process continues. If a patient can't be reached, the office decides on the next steps. Scheduling coordinator staff patients need immediate visits. Results are logged and reported to management. Let's look at the sample situations for clinicians. Imagine it's a Sunday evening and a severe storm is approaching your area. The Comfort Home Health Agency has initiated a call tree process to ensure the safety of patients. As a clinician, here's your role. You receive a call from the administrator who informs you about impending storm and the importance of reaching out to your assigned patients promptly. You're told to prioritize patients based on their triage level. You immediately call your patients. Your first call is to level 1 patient, Mr. Johnson, who requires uninterrupted services. You successfully reach him, confirm his safety, and discuss any immediate needs or concerns. You reassure him and document the conversation. After ensuring Mr. Johnson's well being, you proceed to call your level 2 patients, starting with Mrs. Smith. You reach her, and although she's anxious about the storm, she has a plan in place and feels safe. You document this conversation as well. You move on to your level 3 patients. While calling Mrs. Rodriguez, you find that she's already evacuated to a safer location with the help of her family. You confirm her whereabouts, commend her for her preparedness, and note the information. Unfortunately, one of your level 1 patients, Mr. Martinez, does not answer. You leave him a detailed message about the storm and your concerns. You then contact the office to report the situation. You inform the office about patients you've reached and their statuses. The office team decides to schedule immediate visit for Mr. Johnson who requires uninterrupted care. You maintain a record of each call, noting patients' responses, safety status, and any specific needs or instructions. This information will be shared with the office for further action. By following these steps, you ensure that your patients are checked on, informed, and provided with necessary care and support during the storm, all while prioritizing their safety and well being. Congratulations! You've now completed the Comfort Home Health Emergency Management training. Remember, being prepared can make a significant difference in the safety and well being of both our staff and patients during emergencies. Thank you for your dedication in providing excellent care. Once again, thank you and have a good day.